Namaskar and a very warm welcome to the 5th edition of the Phone In program. I'm Nidhi Kumar and you're watching India Science. The third phase of COVID-19 vaccination, in which people above 50 years of age will be vaccinated, is expected to start next month. The exact figure of the total vaccinated people till now is 58 lakhs, 12,362 till today. The COVID-19 vaccination drive was launched on January 16 to vaccinate 1 crore health workers in the first phase and is going on smoothly. It is possible that in the next month, the third phase will start, in which citizens over 50 years will be vaccinated across the country. In this special edition of the Phone In program, where you can ask your questions and we take your queries live, we have today with us in our studios Dr. Sanjay Tyagi, Director, Professor Cardiology, GB Pant, PG Medical Institute, Delhi, ex-DGHS, Government of India. Many thanks for joining us today, sir. Namaste and welcome. My first question would be to you, and which is, sir, the fifth round of the sero surveillance in Delhi suggested that 50% of those who were vaccinated have developed antibodies against COVID-19. What does this tell us about herd immunity?
No, the herd immunity is said when over 70% of the persons are having antibodies in their blood against that particular disease. So as to prevent the transmission of that virus from one person to another, this reduces, it is like on a road, you have a road blockers. Similarly, for the transmission of virus, if the person is not immune, he can get the disease very easily. But if he has developed antibodies against that, so that virus, if it enters even the body, that it will not cause the disease, and this virus will get destroyed. So if large number of persons develop this immunity against that virus cannot cause disease, and this progression of that virus will be reduced further. So that is called herd immunity.
Correct, sir. I would like to know, you took the vaccine, so how did you feel? Can you share that experience?
See, I would like to say that this vaccine is very safe. I took the vaccine about 2 weeks back, and now most of the doctors and the nurses in our hospital and the paramedical workers are voluntarily taking this vaccine and have very minimal or no side effects. Only few persons develop mild fever, nothing else. No major problem have been found in these persons who have been vaccinated. And so many more are now voluntarily coming over to get vaccine to save you from such a dreaded disease, which has affected in last 1 year and caused more than 10 lakhs deaths all over the world. And India also, more than 1 lakh deaths have occurred. So it's a very serious disease, and such a simple thing can prevent you from developing infection. So one should go ahead and get the vaccine at the first available opportunity.
Absolutely. As soon as the COVID app says you're eligible.
Yes.
We're joined by a caller, sir. We have with us Rajan from Surat. Namaste, Rajan, and welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. I have a question. Can people on blood thinners get the vaccine?
Yes, this is a very important question and a very common question that is being asked. See, one should know what is a blood thinner. Most of the persons who have angina or heart attack or have undergone angioplasty or even bypass surgery are on antiplatelet drugs, that is aspirin-like drugs. Aspirin is a very common medicine you take even for headache. It causes the platelet function to reduce so that clot does not form in the body. So it is a type of blood thinner, but not exactly blood thinner. What are blood thinners? Blood thinners are anticoagulants, like heparin injection you give to make the blood thin and so it does not clot. Even the oral drugs like acetylene, warfarin, and now newer oral anticoagulants are available, and then these can cause prevention of clot formation in the body. These are given in patients who have developed atrial fibrillation to prevent clot formation in the heart, and so that clot which forms cannot get embolized to the brain and cause stroke. Or some persons who have got heart operation, valve replacement surgery, they are given blood thinners to prevent the development of this clot inside the heart and to prevent the embolization and the complications. So these drugs, which are like heparin and warfarin, So they can cause, if if in those persons these injections are given, they can cause a hematoma formation, a blood clot type of formation in the portion where injection has been given. But no problem has been found to be in those patients who are given antiplatelet drugs, which are a minor form of blood thinner drugs. But now it has been found that even in patients who are on blood thinners, these vaccines can be given safely, and most what possibly can occur is a small induration or hematoma formation and blueness at the site of injection, nothing serious. So they can be given. There is no contraindication to giving these COVID vaccine in those patients who are anti-platelet drugs and or anti-coagulant drugs, or that is called blood thinners. So no problem in getting vaccination or those patients who are on blood thinners.
So well explained, doctor. Like a true cardiologist. I'm sure, Rajan, your question stands answered. And we're now joined by Rekha from Delhi. Namaste, Rekha. Welcome to India Science. Please ask your question.
Namaste, sir. So, my question is the risk of developing severe COVID-19 symptoms similar for all the patients with a heart condition, or are there any differences between them?
Yes, very good question. See, the COVID affects more severely in those persons who are above 60 years of age or who have comorbid conditions. What are these comorbid conditions? Comorbid conditions are like person having diabetes, high blood pressure, heart conditions, lung conditions. These are comorbid conditions, and when the COVID virus or coronavirus enters the lungs, and then it causes systemic inflammation inside the body. These inflammation can cause damage to the lungs and can affect other organs of the body. They can affect the heart, they can affect the brain, they can even affect the kidneys and cause clot formation all over the body. So in persons who are having these problems, like comorbid conditions like diabetes, hypertension, cancer conditions, lung conditions, they are at much higher risk because their own immune system is weak. So these coronavirus affects them more seriously. So they need to have much higher prevention and safer approach in these times.
Absolutely, sir. I hope, Rekha, your question stands answered, Rekha.
Definitely, ma'am. Thank you so much.
I think your program is very popular. You have so long question in such a short time. It has become one of the most popular programs of
Thank
India
you.
Science.
Thank you so much, sir. We now joined by Harish Sharma from Agra. Namaste, Harish. Welcome to India Science. Please ask your question. I'm sorry, he's from Ghaziabad. I'm sorry. Harish from Ghaziabad, are you there?
My question is, I have read that the coronavirus can cause heart problems such as heart attack or arrhythmias. Is it true?
Absolutely, you are right. See, it causes a very serious problem in the heart. And in last 1 year,
Hello?
yes, you are right. I would say you are right. In last 1 year, since
Hello?
hello, are you able to hear me? See, I would say that in last 1 year, we have seen large number of patients with the COVID infection.
Hello?
Can you hear us, Harish? Namaste, can you hear us?
आवाज नहीं आ रही है. Hello? Hello, ma'am?
Yes, yes. Namaste. Can you hear us now? Are we audible?
Yes, yes.
Yes.
Okay, sir.
See,
My question is, I have read that the coronavirus can cause heart problems.
Yes, you are absolutely right. It affects as I said earlier, it affects all the organs of the body, maybe brain, heart, lung, kidneys, and all the organs of the body. So what corona does, when it enters inside the body, it attaches with the help of its spikes.
Hello?
Yes, please listen carefully. See, it attaches with the help of spikes inside and causes inflammation. It enters the lungs and in the endothelium it attaches and causes inflammation. And that inflammation causes a release of cytokines, and these cytokines, or these are the chemicals which causes damage in the heart and causes blood to thicken and cause clot formation inside the heart. And when the clot forms inside the heart, it can cause heart attack and it also can affect the muscles of the heart, leading to weakness of the muscle of the heart or heart failure. We have seen many patients, particularly even young patients, coming with heart attacks in these corona times, and when we tested them for this COVID infection. By RT-PCR, we found them to be positive, and they were actually patient of COVID infection, which presented as heart attack. So it can present as heart attack and heart failure very commonly, apart from pneumonia, which is a very common problem caused by this coronavirus.
I hope your question stands answered, Harish. We go on to the next caller. We have with us Kriti Khanna from Meerut. Namaste, Smriti Khanna from Meerut. Yes, Smriti. Namaste. Welcome to India Science. Please ask your question. Can you hear me, Smriti? I think we've lost the call. Meanwhile, doctor, can you tell us about the variant in Brazil that is more transmissible? What is the new variant?
You are absolutely right. See, the coronavirus that started initially from China, Wuhan, then it migrated to all over the world, maybe Italy and European countries, and then came to India. So, but a new variant was found in United Kingdom. Initially, a new variant was formed, and it was found.
And even in Africa.
Now another variant has been found in Africa. It has been found that these variants which are found in United Kingdom and in Africa are more deadly variants. They are more transmissible. That means it can, from one person to another, they are easily transmitted and cause infection as compared to the previous virus which came from Wuhan. So these, compared to the China virus, these virus from UK and from Africa are more transmissible and cause more deadly disease. It has been estimated in today itself there was a report from France that in March the more than 50% of the cases in France and United Kingdom would be from these newer variants, and which will be difficult to control. So it should be we should have a very aggressive approach towards vaccination and to prevent the development of this COVID infection, even if these types of variants comes. Another thing that one should remember is that even when these types of virus comes, one need to not be very afraid, because every year we get a new influenza vaccine. So these now we have mastered the art of developing vaccine against this coronavirus. So we'll have vaccine against the new variants also. And at the moment, the vaccines which are available to us are effective against these virus. So go ahead and take a
take
COVID
that shot,
vaccine.
absolutely. She's joining us now from Meerut. Kriti, welcome to India Science. Smriti, welcome to India Science.
Thank you, ma'am.
Please ask
Hello.
your question. Yes.
Sir, I wanted to know, are these vaccines safe for people who are having a history of, heart disease or have suffered from heart attack?
See, as I said, these persons who have a history of heart disease or heart attack or any other problem are more vulnerable population. So they need more protection. So apart from the mask, careful distancing and the hand washing techniques, you need another extra protection to save them from developing these type of infection. If it develops, it would be very serious. So, and these vaccines in these heart patients have been found to be very safe. No problem at all in these patients. In fact, they are a priority group for us to give vaccine in the next round, which starts in March. We would be giving these vaccines to these priority group or having heart problems, lung problems or diabetes, these vulnerable population that we call.
I hope that
Right.
answers your question, Smriti.
Thank you so much.
Thank you so much. We now have another caller from Rajkot. His name is Jatin. Welcome to India Science, Jatin. पूछिए आप अपना सवाल.
Hello.
Namaste.
Good afternoon, ma'am. Good afternoon, sir.
Good afternoon.
So my question is, once one person gets the vaccine and waits for 2 weeks, can they get in touch with family members who lie outside their household who are not yet vaccinated?
See, your question is not very clear, but what I understand is that if a person has got vaccine and his terms comes for the next vaccination after 4 weeks, can he give that chance to his other family member? Is that your question?
Yes, that is.
Yeah, if that is your question, I think why you should understand why we give a second dose of vaccine. It is given to boost up the immune system. When you are taking first vaccine, your blood cells, that is the T lymphocytes and B lymphocytes, start producing antibodies, and they develop some immune reaction and antibodies start developing. But when you give a booster dose, then it gives a higher dose of these antibodies, and the T cells also become activated, so as to prevent the development of the further coronavirus. So every person should have 2 doses of vaccine. If you take only 1 shot of this COVID vaccine, your the cover will be markedly reduced. So person should take, and when their turn will come, they will certainly get the vaccination. Don't worry about them. Government is very want to give vaccination to all the persons who are at risk of developing this COVID infection. Don't worry.
I hope that answers your question, Jatin. We now joined by another caller. So we have Gaurav Gupta from Kanpur. Namaste, Gaurav. Welcome to India Science. Please ask your question.
Namaste,
Yeah.
sir. My question is, are unvaccinated children safer from the virus once their parents and teachers are vaccinated?
See, children tend to develop lower grade of infection and much lower. So they are relatively safe. But if their parents and teachers have got vaccinated, the chance of transmission of virus from their parents or their relations or their teachers are reduced in these children. But one needs to remember that at the moment we are giving vaccine above 18 years of age and not to the children. The trials for children are at the moment going to start, whether vaccine can be given safely to children. We need a very safe vaccine in children. And what type of vaccine that we need? In world over, only dead virus vaccine, that is inactivated vaccine, are given for to the children. Any type of infection which we want to prevent and you want to give vaccine to the children, the dead virus vaccine is given. At the moment, what vaccine we have is, we have 2 types of vaccine in our country, that is Covishield and Covaxin. Covishield is a chimpanzee virus which causes influenza in the chimpanzee, and that has been inactivated and causes RNA, messenger RNA production inside, and that causes antibody formation. Another vaccine, that is Covaxin, is a dead virus. So from next month, the trials in children are going to start, whether we can give them this the vaccine which has been developed from isolation. In Pune, we have a virology institute of the government of India. They isolated the coronavirus, and then this virus was given to this Bharat Biotech. They developed this virus, and then they developed a vaccine against this virus by inactivating that virus, by making that virus dead, and that is given in the dose in the intramuscular injection in the form of Covaxin injection. So this type of vaccine, which is not live vaccine, would be a safer vaccine for the children. But at the moment, because we do not have any data world over, so we are not giving any vaccine to the children less than 18 years of age.
बिल्कुल. और मैं यहाँ कहना चाहूँगी कि उस ढाबे में जो काम कर रहा है, किसी मुंबई के कोई ढाबे में, थाने का फॉर एग्जांपल, कोई बच्चा हो 14 साल का, उसके बारे में भी हमें और आपको सोचना पड़ेगा. थैंक यू सो मच गौरव फॉर जॉइनिंग अस, एंड नाउ वी आर जॉइन्ड बाय येट अनदर कॉलर, सुमिता फ्रॉम मुंबई. नमस्ते, वेलकम टू इंडिया साइंस. प्लीज आस्क योर क्वेश्चन.
Ma'am, I want to ask, I hear some people have...
Can you be a little louder, Sumita? We can't hear you. A little louder.
Hello?
Yes.
Sir, my question is, I hear some people have an allergic reaction. As a heart patient, will I have an increased risk of an allergic reaction?
It's a very important question you have asked. See, the allergic reaction to the vaccine is very, very rare. Very rare. And this is called anaphylaxis. And those persons who have history of anaphylaxis to any of the component of the vaccine can develop this allergic reaction. But for that, whenever we give vaccine to any person, that person is kept there in the hospital or at the vaccine center for half hour to 1 hour, so that if any untoward side effect, anaphylaxis develops immediately after the infection, so that can be treated immediately. So that precaution is being taken, so that any person who develops this type of allergic reaction can be treated safely with the help of injections which are given for the allergy. So do not worry about that. The centers which are giving vaccine are equipped to handle that problem, but that problem is very, very rare. Common problem, what are the common problems? The common problems are that you may have some soreness at your deltoid muscle where you get given injection. You may have some mild fever. Out of 100, 1 or 2 persons may develop very mild fever or myalgia type of problem. So these are the common problems. Even some person may develop flu-like symptoms, some runny nose or sore throat. These are also very rare, which we have not seen in our experience in last about a month that we have started giving vaccine at our hospital. Very, very rare. Very few patients develop a mild dose of fever, which was very easily treated with the help of one tablet of paracetamol if required at all.
So I hope that answers your question, Sumita. Thank you so much for joining us. We now have Kriti from Pune. Namaste, Kriti. Welcome to India Science. Please ask your question.
Namaste, Nidhi ji. Before I ask my question, I must, express my gratitude for having such a show, because मन में इतने सारे सवाल होते हैं regarding the vaccination and the COVID-19 that we want to clarify it from somewhere, and I think this is a very good platform. So,
Thank you so much. Thank you so much. And we have with us the cardiology specialist of India today, Dr. Sanjay Tyagi, who will answer your questions. A lot of
Hello,
questions
sir.
on heart have been coming, and I'm so happy about that. Please ask your question, Kriti.
Okay. So my question is, are cardiac patients who also have diabetes or say hypertension, are they at a greater risk?
Greater risk from COVID? Yes, they are at greater risk from COVID. They are at greater risk of developing serious type of COVID infection. So they need more active preventive strategy in those patients who are having any of these problems.
If you could quantify that, sir, because the viewer may have joined us right now, and what you said, maybe you'd
Yes.
like to quantify the heart-related thing so that it's very clear. That the patients go for the vaccine is the endeavor of this program.
See, these patients who are at having heart problems, diabetes or cancer problem, or even lung problems, or like bronchial asthma, and any person who are taking steroids, their immune system is depressed. So they need extra protection. And what we have seen in last 1 year of the corona, that in our emergency units, in our GB Pant Hospital and Lok Nayak Hospital, which have been the major centers where these COVID patients have been coming, these patients often come with heart failure, because even after their lungs are get affected, their heart also gets affected, and about the chances of developing heart problems are about 30% these patients who are having serious type of COVID infection. And what types of heart problems? They can get heart attacks, they can get heart failures, and they can get arrhythmias or heart blocks they can get, and they can had sudden death also due to these heart problems. So these patients of heart diseases and lung diseases, diabetes, need extra protection apart from these your wearing a mask or having distancing or cleaning your hands. You need extra protection in the form of COVID vaccine at the earliest.
Absolutely. That answers your question, Kriti. Thank you for joining us. We're now joined by a caller from Nasik, Nena. Welcome to the program. Namaste. Welcome to India Science. Please ask your question.
Good afternoon, ma'am. Good afternoon, sir. Sir, I have a very important question, as I am a heart patient. So I have the question that I know that I should not go to the hospital if I think that I'm infected. But when in that situation that I seek medical attention, if I have a pre-existing heart condition, what should I do?
Pre-existing heart condition, if you have, you contact your doctor, and yes, if you have any problem, see, if you have high blood pressure, suppose you have high blood pressure, continue taking your medicine for high blood pressure. Similarly, for any other problem like diabetes, etc., continue taking your medicine. And also, apart from medicines, you should continue your active lifestyle and the exercise, so as to prevent the development of these high blood pressure. Diabetes aggravates if you are sedentary. So continue with your walks, go for morning walks and take your regular medications so as to keep your high blood pressure, diabetes under control, and take your heart medicines also regularly. If suppose you have in your family member, if your mother or father or anybody, any member has heart problems, have an angina or having valve heart disease, so they should continue taking their problem. In case they need any help, then doctors are available in the hospital, and one can safely go there with wearing a mask and keep a distance between another patient, or take an appointment from your doctor so that you do not have to wait in a crowded place. So, and show to your doctor if there is any problem.
I hope that answers your question. Thank you, Nana. Namaste. And we are joined by yet another caller from Gwalior, Neeta. Namaste, Neeta. Welcome to India Science.
Namaste, ma'am. Namaste, sir.
Namaskar.
My question is that there are reports that COVID-19 may induce myocarditis or pericarditis. So, I want to know if you've had, both these conditions previously, are you more vulnerable to contracting it a second time?
Yes. See, whatever, if your heart is already weak with the myocarditis means the muscle of the heart has become weak. If your muscle of the heart has become weak, any extra insult on that muscle will further reduce the contractility and would put the patient in further heart failure. So, those persons who are having myocarditis, pericarditis, or heart muscle is weak, cardiomyopathy, these are extra vulnerable to the effects of these COVID infection. They need to take extra precaution and so as to prevent the development of any COVID type of infection in their body.
Sir, thank you so much, Nana, for joining us. One question I'd like to ask you, sir. If I take the vaccine, this has been coming to us of late in our chat series. Is it possible to take painkillers before or after the vaccine is administered?
It is absolutely safe to take a painkiller before and after, in case, but I would recommend that in case you have any problem, then only take any painkiller, because every medicine has some side effects. So, if you require, then only take, do not take if it is not required.
Don't just pop it in.
Yes, because it does not affect the immune response in the body after giving vaccine. But any medicine should be taken only when it is required.
So, what is your concluding statement for heart patients, people with this kind of history? Is there some kind of a way that the GOI is looking at where people with serious problems in heart could perhaps be given this vaccine first, even if they are 30, 35 years of age?
Yes. These persons who have comorbid conditions, that is heart problems, lung problems, and diabetes, and elderly persons, these are a priority group. In the next round, starting in March, we will be giving these vaccines to these persons. And those persons who are having heart problems should have to take all the precautions to prevent the development of heart problems, or if they have heart problems, they should continue taking their medication. Also, a good lifestyle, that is, avoid the tobacco, any form, like smoking or tobacco in any form, chewing any tobacco in any form, or do a regular exercise, keep your blood sugar under check, keep your cholesterol under check, and keep your obesity under check if you have obesity, and do a regular exercise. Regular daily 30 to 40 minutes of brisk walking should be done. It helps to reduce your blood pressure, it helps to reduce your cholesterol, helps to reduce your diabetes, and keep your heart, muscles and brain fit. So even in these times, which are currently times, and now the weather is much better, and you should go for walk and keep your heart and body fit, and take your regular medications for your heart conditions or any other disease that you have, and certainly keep your mask and do a good distancing from the person who, if you have to go into a market or any other place, keep a distance from that person. And whenever you get a chance to have vaccination, please go ahead and get your vaccine to make yourself extra safe.
But they need to be figured in the COVID app, sir.
Yes.
That is one thing that we're looking at,
Absolutely,
Doctor. We have so many callers, and I'm so sorry that we're running out of time. We'll take your questions next time, or you can send it on our chat group at India Science, and we'll answer it for you. In the end, I'd like to thank you, Dr. Tyagi, for joining us today. With this is a wrap on the 5th edition of the Phone In. And to all our viewers, the Government of India is taking all necessary steps to ensure that we are prepared well to face the challenges and the threat posed by the coronavirus variants, as well as Dr. Tyagi told us. So let's get vaccinated, India. Thank you for watching. Namaste. Keep watching India Science. Namaskar.
Stay safe.